At the same time, intern doctors have, for a second week running, staged a demonstration outside Afya House to protest delayed payment. The intern medics, who marched from their internship center at Kenyatta National Hospital to the Ministry of Health, accused the government of skewed priorities and plunging the healthcare department into a crisis. Let's get more from our very own Mary Mwok.
Chanting what has become an all-too-familiar tune in the labor movement in the country, intern doctors for the second time in as many weeks held protest outside Afya House. The interns are protesting salary delays by the government and what they term as back-breaking labor with no compensation by the government. Even as they staged a sit-in at Afya House, the health CS, who appeared undisturbed by the doctors' pleas, left in this motorcade, drawing the ire of these junior medics.
When you go to any level 4, 5 and 6 hospitals, we are the first people whom you will meet there. We heard that the CS was around, but immediately we arrived, she decided to assume us and leave. What does that show? That these people are not willing or ready to listen to the junior doctors.
Barely recovered from the prolonged strike in April this year, the health sector has yet again been plunged into turmoil with the withdrawal of services by the intern doctors, who are demanding an immediate payment of their 4-month salary arrears before they can return to work. Dressed in white lab coats, the young medical professionals carried placards and a coffin symbolizing their colleagues who've died from suicide after working for months with no pay.
Failure to find a long-lasting solution to this problem will result to mental health issues to intern doctors who are bona fide citizens of this country.
I have not had my pay for the past 4 months.
Yes.
Internship itself is so draining, physically, emotionally, and psychologically. It is so bad that we've lost some of us, and the government still cannot see. People are suicidal. I myself, if you ask me, has the thought ever crossed my mind? Multiple times.
And they've already been out of work since last month. They'll be out of work until they're paid in full. Secondly, there are agreements on the basic salary arrears for the doctors. We have waited from July, August, September, now we are in November and December.
Doctors in Kiambu County and in Central Region have also vowed to down their tools and join their colleagues countrywide on the 21st of this month if the emerging issues they raised will not have been addressed by then.
Doctors are demotivated. Therefore, in as much as hospitals are still there, gates are open, people are working under duress, we will not be able to offer the services as expected, and when nationwide everybody puts the tools down.
The doctors of Kiambu are frustrated, they're more disillusioned, because the frustrations and the suffering that they're going through is too much. Next week, if the issues that Kiambu County are already implemented, even if you go on a national strike, those things will have to be resolved.
Mary Mwok, Citizen TV.